to Ask Dr. Liz. Today's question is there anything bad that can happen to my teeth if I'm constantly clenching them? So you're just kind of bearing down on the teeth, you're not necessarily grinding them. Yes, there's absolutely bad things that can happen when you clench. The teeth are very strong. The jaw is very strong. When you bite together, you can crack open popcorn kernels. You can crunch ice with your teeth. There's a lot of force there. And enamel is strong, but over time, if you're clenched very hard on your back teeth, you can crack your teeth. When you crack a tooth, most of the time, it's going to need a crown. A crown is very expensive, and a lot of times when you're clenching, you're cracking several back teeth. Suddenly you need 2 crowns, 4 crowns, 8 crowns. I've seen people who've had to have every tooth in their mouth crowned because they just keep cracking them. It's extremely painful when you crack a tooth, and the only other solution would be to take the tooth out, and that's a terrible solution. Nobody wants that. So yes, clenching and grinding is very destructive to the tooth. You can break your teeth, you can wear the enamel down, and you can create jaw joint problems, inflammation in the temporomandibular joint here, and then you can get constant pain all the time in the jaw joint. I've had patients come in who couldn't open their mouth because they'd been clenching it so hard all day and all night long that they got so much inflammation in the joint that they couldn't open or close the joint. And they're talking like this, and they say it just hurts so bad. And we put you on a muscle relaxer, but we got to get the inflammation down before we can do any therapy to the joint. So what we normally do in dentistry, the go-to treatment is a bite splint. You can get upper bite splints, lower bite splints. Different dentists have different philosophies on which one to use and why. Come into our office, let us take a look at it, see if you're a candidate. If you've been clenching and grinding, we're going to be able to tell just by looking at your teeth and your muscles and your jaw muscles and your joints. So if you need a bite splint, they're a fraction of the cost of one single crown. They could save you from needing a good handful of crowns, and they're a wonderful thing if you need them, and they can cause a lot of relaxation. Some people say, I wore my bite splint, I fell asleep immediately. I've never done that in my whole life, and I slept the whole night, and now I'll never go without a bite splint. Other people, say, yeah, well, sure, I wear it just because I think that, I'm going to need a crown if I keep clenching. So you can get a great response out of a bite splint. It can be a wonderful thing. But if you're clenching all the time, you really need to get something in there. Over-the-counter bite splints tend to have a little bit of give or a little bit of squish to them, and that will actually make you clench and grind more all night long when you wear it. You want a bite splint that's rock hard, rock solid, and is made properly for your bite to help pull the joint down and release inflammation back there. So unlike a lot of over-the-counter products that I don't really have a problem with, bite splints really need to be made by a professional. You need to have one made by a dentist, or you could be making the situation worse. So if you have any other questions about bite splints, this is a favorite topic of mine. I love to talk about it. Make an appointment, come on in and see me, and we'll get you taken care of and see what you need. So thanks for asking the question. It's been Ask Dr. Liz.